All right, so we are looking at bones and skeletal tissues. Why is it important to understand tissues? His head just went down. What do tissues create? Organs, skin, muscle, heart, system, everything, okay? And if you can understand the basics of tissues, you can build upon that so you can understand the basics of organs and us as a system. Anybody in or interested in going into research? Tissues. You know, if you're going to do human studies, you're going to be looking at cell cytology and histology and how they complement and function together. A lot of the diseases that we have begin because of a dysfunction in the tissues. And if you have a good grasp on that, you can describe the disease or the pathology that goes along with it. Okay? So, that's fine. I know you guys don't love them, but we talk about them. Okay? So, do we start as a little person? You know, I've told this to people I had last semester, but I'll say it to my new people. And I'm being taped right now, so I might be embarrassed later, but I'll say it. There were scientists who believed that male ejaculate had little people in it. And the ejaculate would go into the woman, and one of the little people, or two or three, if there was twins or triplets, would embed into the uterus and grow. Not so much, right? What actually happens is the egg and the sperm unite. We create a combination of that DNA. We get a cell. That cell replicates and it begins to form a tissue, right? Well, I should say it's more of a little ball of cells. It grows, it forms 3 layers of tissues, and from those 3 layers of tissues, we derive all the structures of the body, okay? So it's more of a gradual process how we develop these tissues. And what happens with skeletal tissues is it either starts as a membrane, which I'll talk to you about in a little bit, or cartilage, okay? The majority, if you have to guess, of the body, of the skeleton, is made from cartilage. So all these bones that we have in our body begin as cartilage. Over time, that cartilage will ossify. What does that mean, ossify?
It makes a stretching bone.
Yeah, to add minerals to the bone, right? Different sorts of calcium, phosphates, and whatnot, okay? That'll harden the bone and make it that strong skeletal structure that we need, okay? So calcification or ossification is that transition. Skeletal cartilage. Now, skeletal cartilages, let's talk about different types of cartilage in the body. Once again, if you have to guess at one, hyalin's a good guess because it's going to form the majority of the skeletal structures of the body, the ends of joints, the connections between the ribs and the sternum. It's the majority of the precursor of the skeleton. It's the majority of the cartilage in the body, except for elastic cartilage. And the way to remember that is we find elastic cartilage in the ear and the epiglottis. Good morning. Okay, the ear and the epiglottis. So E, 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 easy to remember, right? And fibrocartilage. Fibrocartilage is found in discs. Where do we find discs in the body? Spine, jaw, elbow, knee, okay? Where we need that cushion between bones, okay? So fibrocartilage discs, EEE for elastic, hyalin's everything else, okay? Hyalin's everything else, including the precursor of the bony skeleton, okay? Any questions on that? Why are they considered different cartilages, do you think? Good morning.
Because it doesn't some under pressure or something like that can handle more pressure than others?
They'll have different compressive and tensile strengths, excellent. And in order to get those different strengths, you will have different what in them? Yeah, fibers. Okay, you're gonna have different types of fibers. There's collagen, there's elastic, and there's reticular, okay? Collagen sounds familiar, doesn't it? I think we've heard of collagen. Collagen is the buzzword for us older ladies, right? Because the collagen is what breaks down in the dermis and you start to get what? Wrinkles. Collagen is a nice, big, fat, juicy fiber that we'll find in different areas of the body, including, yeah, I'm going off notes. Esther, are you panicking? No, okay. I saw her looking. I've gone off the notes a little bit, okay? Collagen are nice, big, fat, juicy fibers that help to support the cartilage as well as the dermis of the skin in different areas of the body. Then we have elastic fibers, which will be what? More elastic. We'll find more of those concentrated in your elastic cartilage, okay? And then we have reticular fibers, which are smaller, thinner fibers, okay? So a little bit off book there. But these different fibers give different strength to these elastic cartilages, fibrocartilages, and hyaline cartilage, okay? Good? Any questions on that, okay? All right. So classification of bones. There's 206 bones in the body. Some people say differently because we have what are called sesamoid bones, which are these little bones that can actually form in tendons, okay, just so you know. But if we go purely by the book, 206. Now the breakdown of the body, and this should sound familiar, is axial versus appendicular skeleton, okay? Let's be really specific about that definition though, okay? Axial skeleton will be the skull and the spine, okay? Appendicular, I always remembered because it sounds like appendages or appendage, right? And an appendage is the what? Extremities, okay? So your shoulder girdle, which is your clavicle and your scapula, and your arms, your pelvic girdle, and your legs will be your appendicular skeleton, okay? Oh, I didn't include ribs there on axial, okay? So skull, spine, ribs, axial, appendicular are the girdles and the extremities. Are you with me? Yeah? Okay. Excuse me. Classification of shape. I gotta tell you, I don't go nuts on this because I think it makes sense. You know, long bones, short bones, irregular bones. I really won't test you on those. I want you to know the names and structures on the bones, okay? The only thing that we're gonna talk about with bone shapes is what's in long bones in just a minute or two, because that's important, okay? I'll give you the basics of flat or irregular bones as well, all right? Now this is an interesting concept for those who are new. Excuse me. Little sidebar. For those of you who are new, I obviously can't drink my coffee, but we do a different order than other anatomy classes. So that's another reason to come see me. I can easily get you caught up with stuff that you need to know, okay? So a lot of this probably sounds familiar to people who have had EMP1 somewhere else. Now, in addition to our shapely figures, support is pretty obvious, right? Protect, pretty obvious. Movement, got it. Mineral storage, okay? This is something to really think about. Now, obviously, we will use calcium in their calcium, stored as calcium phosphates in our bones, and we also have hydroxyapatites. That's okay, just go by what I give you, okay? So let's just talk about calcium. Calcium is stored in the bones, okay? Who can tell me what else calcium is used for in the body? Everybody is doing it right now, and it's going about 60 to 100 beats per minute. Muscle contraction. Heart, skeletal, even smooth. You use calcium for that contraction and function of muscles in the body. Are you with me? So if we don't have enough calcium in our diet and in the food that we eat, guess where we suck it out of? The bones. Because is it more important to have a strong bone or keep your heart going? Heart, right? So calcium is stored in the bones. It's important, but calcium is a huge part of how our muscles contract, all of them. So we need to make sure we have enough calcium in the bloodstream in order to make those muscles function properly. That's why we should have adequate levels of calcium, okay? As well as vitamin D. That's a whole different sidebar. K2 as well. But anyway, if you're interested, come see me. Okay, so blood cell formation is something else that we will see in bones. We have yellow marrow, which stores fat, but we also have red marrow. And that's where we will have a network of creation of blood cells to be released out into the bloodstream in order to allow us to, sorry, I thought my phone was ringing, provide our body with enough oxygen and immunity to function properly. Okay? We'll get into that in the future. Cool? Any questions? Okay, bone structure. Bones are organs. Why? What's our definition of an organ from A&P 1? It is two or more tissues that function together for a specific physiology, right? So if we were to look at the bones, they're not just made of calcium, right? They're made up of a network of calcium and different minerals that create the bony structure, and we also have a layer on the outside. We have red marrow, we have yellow marrow. It's multiple tissues that provide all these functions. Good. Okay, so when we look at bone, I'm just going to turn the lights off for 2 seconds here so we can see that picture really well. And then I'll pop them back on. On the outside of bone, we have what's called compact bone. Okay? And guess why it's called compact bone? Right? It's all smushed together. Yay! Something that made sense in anatomy. On the inside, we have spongy bone. Pardon me. It's spongy because obviously it looks like a sponge. It's not nearly as compact. Which one will be stronger? Compact. Around all those different shaped bones that I mentioned earlier, you have compact bone. And on the inside, you have spongy bone. If we were to make them all spongy, they'd fall apart. If we were to make them all compact, they'd be too heavy, right? So this is a nice combination of the two to create a very, very strong bone, but it's nice and light, so we don't have to carry around a big, heavy noggin all day, right? The other thing that's nice about the spongy bone, guys, is what do we put in there? Blood vessels, right? Bone marrow, right? Gives us little pockets to work with. Is bone vascular? What do I mean by vascular? Well, we're here talking about this. Maybe it has blood vessels.
Oh.
Is it? Isn't that what you said?
I said, yeah, I said.
Yeah, you absolutely said.
Oh,
okay. Yeah, vascular. Yes, vascular. How do we know it's vascular?
Yeah, so make sure your red muscles are.
You're on the right track. Who's broken a bone? How fast does it heal? You were a cast for 4 to 6 weeks, right? Who's torn your cartilage? How fast did that heal? It did? Yeah, because they fixed it, right? Okay, I was like, wait a minute here. If you tear cartilage, it doesn't heal because there is no vascularity. If you break a bone and you get it casted, it will heal because it's very vascular. Are you with me? The more blood supply you have to a tissue, the better it is at repairing itself. right? Okay. We're going to look at the histology of compact bone in a little bit. Excuse me. What I want to talk to you about is a bit more of a concept with bone projections and markings. And we're going to look at some of these markings on the actual bones themselves when we get into lab. Okay? If you have a raised area on a bone, what do you think might attach there? Muscles. Specifically a tendon. Okay? Muscles will attach to a bone by a tendon. That pressure onto the bone tells the bone it's slightly stressed. The bone's response to that is to add more bone. I have, and I've told people this, I always try to use examples. I have a very short leg. I was just born that way. Have you guys done the genetics of the ear, where you do the one that's attached and the one that's not? I have one of each. And I also have a short leg. I think it's all kind of genetically intertwined, but anyway, that's a different story. I have a very short leg, was born with it, and I walk funny. Well, I have a bone spur on this hip, because I've walked funny for so long. That bone spur is additional bone that's in response to abnormal pressure, right? But anytime you put pressure on a bone, whether it's abnormal or normal, you will deposit more bone there. So where we have muscles attaching, there's more pressure, there's more stress, and so the body puts a little more bone there to make it stronger. Are you with me? But the same premise creates bone spurs. Because the body goes, oh, there's stress here for some reason. I'm going to put a little more bone there to try to support it. So it's an abnormal application of a normal function. Yes? Okay. All right, are you with me? Okay. How did I get there? Oh, bone markings. Whew, thought I jumped ship. Okay. Now, if you look at the bottom of the skull, or when you look at the bottom of the skull, there's a ton of holes. We're going to go over a whole bunch of them. Okay? What do you think passes through the holes? Veins and arteries and nerves in the spinal cord. So whenever you have an opening in a bone, usually vein, artery, or nerve will pass through it. Okay, so that's a general gist when you start to look at bones and these structures and what's happening here. Okay, any questions? Excuse me. So I told you we're not going to go over, all those shaped bones, but I do want you to know the parts of a long bone. It's an important concept and idea to get into your head. The ends are the epiphysis. Can you guys read this? Can you read the words like okay? Okay. Would it help if I turn the light off for this little part? Maybe, yeah. Can you see enough to write if I turn the lights off? Okay. So, because I'm not quite sure you can read the words in your book, and we're going to write down most of this. So, can everybody see it now? Everybody in the back be able to see it? All right, okay, great. So the ends are the epiphysis, okay? Epiphyses is plural, but the epiphysis is singular, okay? So this is one epiphysis, this is two epiphysis, okay? And I should actually point a little bit higher. They are the ends. Usually they're slightly more rounded or expanded, okay, than the shaft, which is the diathesis. Okay, so ends are epiphysis. Shaft is diathesis. Epiphyses for plural. I won't mince those words, but just so you know. Okay. Between them is the epiphyseal line. Any guess what that is? Yeah, that's your growth plate. I'm going to show you the development of bones in a little bit, but the basic gist is we have 3 different ossification centers that'll start here, here, and here. And if you can imagine they grow out, they're going to do what? Grow close together and you leave a thin line of cartilage right there. And until you've reached your full height, that's where you deposit bone, making those long bones longer. Once you reach your full height, I was this height by the time I was 18. That's generally when our growth plates close in a female. Okay? It'll close up and fully calcify or ossify. Are you with me? Okay. Yeah? No? Good? Okay. Thought I heard a question. Now, on the ends, have you ever eat chicken wings? Who eats chicken wings? Okay. You grab on and then you get that real chewy, right? Everybody loves this correlation. Guess what that chewy is? It's this articular cartilage here. It's that covering on the, I always get one or two like faces. It's the covering on the ends of those long bones. And guess why we leave that cartilage there? Exactly. Because don't forget, we're looking at one bone here. This bone is going to touch in with another bone. You don't want them to be bone on bone. That would be very uncomfortable. And the articular cartilage is there with other things to create a softened end to that bone. So when you form the joint with the other bone, it's pretty comfortable. This is one of the things that wears away as we start to get arthritis, the articular cartilage. They do have articular cartilage, yeah they do, okay? All right? On the inside of this diathesis, you can see we have, guess what that is? Yellow marrow. On the ends, we have spongy bone, which is probably where the, what's going to be? Red marrow. Okay, I don't think they have that there, but that would be where your red marrow is. The ends of long bones. You can also find it in the hip. That's where they like to take it. The iliac crest, scapula, sternum, vertebral bodies. But the place where they like to get that red marrow, I believe, is the hips, the iliac crest. Okay. Around the rest of the, do you need me to repeat anything, guys? Are you good?
I just missed, you said the red marrow is at the end of the bone?
Yes, at
Okay.
the ends of the bones, of long bones. Yep. I think it's important to know it's also on the iliac crest, which we'll get into in lab,
Okay.
if it doesn't sound familiar yet. All right? Because it's where they like to harvest stitch if we need to get it. All right? Any other, please stop me. Sometimes I get off a little, I love this stuff. I can talk about this stuff for hours. So sometimes I get a little tangent. I had a professor in high school who would do the tangent sign because he knew he would be, you know. So if I get too far off and you guys get lost, just, you know, give me like a reel it in kind of symbol and I'm happy to go over stuff, okay? All right, so around the bone itself is something called the periosteum. Peri meaning around, osteum meaning bone. It's a dense, irregular not dense, I believe it's more loose, irregular connective tissue. Now, the interesting thing about this is it encapsulates the whole bone, okay? And it's innervated. What does that mean? Innervated, what does it sound like? You're on the right track, not a blood vessel. Innervated, has nerves in it, all right? So, when I first started, I'm clinically trained as a chiropractor, okay? And somebody told me a long time ago, do you ever see those tuning forks with the big round, I don't know what hertz it is, but the round ends, do you ever see those? I have one of those in lab, I can pull it out for you. And they come with your set when you buy them for your clinical rotations. And I'm like, what am I ever going to do with that? And somebody I was working with, a doctor, said, you're going to use it to check for fractures. I'm like, yeah, whatever. He goes, now I'm telling you, it's the right hertz. Somebody has a fracture. You think they have a fracture. You know, hit it, put it on there. He goes, they'll scream out in pain. He learned it from a trainer. yeah, okay, whatever. And this little old lady come in, Friday night, lifting up a window, heard a big pop, couldn't move. I'm like, she's fractured a vertebra. She didn't believe me. I'm like, I'm gonna get up that tape work. You know? I go, listen, she wanted her fish fry. That's why she wouldn't go to the ER. I'm like, you gotta go to the ER, you get a fracture. I'm not gonna go on my fish fry, it's Friday. Lady, okay, I go, listen, here's the deal. I go, this is an old trick. I go, if I hit this tuning fork and I put it on there, it's gonna, you scream in pain, it's gonna hurt like the dickens. Promise me you're gonna go to the ER. All right, because she's thinking it's never gonna work. I'm thinking it's never gonna work. Right? I hit it, I put it on there, she was on the floor. She's like, that hurt so bad. Because what it does is it vibrates the periosteum, which is broken, and it goes like this, ding, 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 ding. So, not to say it was cool, because she was in pain, but she believed me. You know what I mean? She's like, all right, I guess I'll just get my friend. I go, I'll buy you a fish fry on the way. I'll take you. You need to go. Anyway, it's because the ends of the periosteum rub up against each other. So, kind of, it's awful, but it's a quick screen. That's the difficult thing when you go into orthopedics is every test you do on a patient hurts.
Unless they didn't break it.
Right, which I knew she broke it anyway, or she herniated a huge disc. I was just hoping I had some sort of proof for her to go. You know what I mean? So she's going, you were right. I had a fracture. So anyway, now while we're on this picture, you can see what's snaking in between this bone. Lots of red blood vessels. Okay, just to sort of emphasize that. And the blood vessel will have one come into the center of the bone and then branch off to all the different parts of the bone. So we're able to deposit bone, repair the bone, get calcium out of the bone, okay, whatever we need to do. The other thing that's important with bone is you can't make bone and just leave it alone. You need to constantly repair it or it will get brittle and give it fresh new nutrients and mineral salts. Are you with me? Okay? All right. So, short bones, compact bone on the outside with spongy bones on the inside. I think that's common sense. Okay, yellow marrows in the diathesis, red marrows, and oh, here's the list. Good. So I have a list of those. I'm going to turn the lights back on. Of those structures where you can find them. Okay? We'll be going over those bones in lab. Let's see what's next. Okay, let's do a quick little break. All right, so I'm moving into the next segment. We go into everybody's favorite, right? Everybody loves the microscope. So sarcasm, right? I love the microscope. Once I learned how to actually look at things, I loved it. But microscopic anatomy of the bone. Excuse me. So we're going to look at specific structures in the bone. We'll look at them in lab. Do you remember looking at them in the fall?
Yeah.
So. Everybody loved how compact bone looked because it looks like what?
Trees.
Trees. It looks like a tree trunk, right? Excuse me. So we've got the circle in the center, right? And then the rings around it. All right? Does that ring a bell? Right? Everybody loves how that looks. Now, when we look at it microscopically though, and this is important to think about as we get into using slides. Is this how bone is structured? Are there a bunch of circles making up the bone, or is it a bunch of tubes? Are you with me? So if we take, I don't have as many, there's a whole bucket of pencils and pens in the lab. I usually grab a handful of, right? So if I take a whole bunch, imagine these were all the same width of pens, and bundle them together, I have a whole bunch of geometric tubes or cylinders, whatever would be specific, right? So if I cut them all at the same level and I aim them at you, now you see a bunch of circles. Are you with me? So it's not circles, it's tubes that they've done a transverse cut of and we're looking down and in. Could you do a linear cut? Absolutely. It's harder to look at all the structures though. That's why they do it this way when they create the slides. Okay, so we're looking down and in on those tubes to look at the different structures that are within the bone when we're talking about that compound bone, okay? So if we look at one of those tubes, it is called an osteon or Herversian system. I call it osteon if you want to pick one, okay? So when we're looking at one complete tube, it's an osteon, okay? We're going to look at exactly how that's structured. The circles are lamellae, lamella for singular. You add an E for plural. Don't drive yourself nuts, okay? Those are the circles that we create. Now, one thing that we didn't talk about in A&P1 is there's those nice fat collagen fibers. And what happens at each circle with those fibers? Do they all go the same way? Yeah. And what does that opposite do? Yeah. In all directions. Are you with me? So look at these circles. So what happens is blood vessels branch out into this tissue. And from these blood vessels, we create what's called an osteoid. It's a soft precursor to bone. And then we start to deposit those mineral salts that we spoke about into it. Right, are you with me? All the collagen fibers from layer 1 on the inside go this way. And then we start to form a second layer on the outside. Same thing, osteoid, mineral salts, collagen fibers. But these collagen fibers go the opposite way. Are you with me? Then what happens? The third layer forms. Osteoid, mineral salts, collagen fibers, they go the opposite way. So if we're creating opposite way, we're creating stability in all directions. If you were to put all of the collagen fibers in one direction, just look up here for a second, and I pull them all that way, if all the fibers went this way, and I pull this way, it'd be pretty strong, right? What would happen if I pulled this way? Come right apart. Just like a loosely weaved sweater. Really strong the length of the fibers, you can pull it right apart the other way. So we crisscross those collagen fibers to make the bone nice and strong. Okay, does that make sense now? And then we keep building those circles out, just like the rings of a tree. Okay. Okay. Does that make sense? The Herversian canal is that center canal where the neurovascular unit goes. Now that's a fancy word, but what does it mean? Neuro means nerve, vascular means a general term for arteries and veins. Okay? So through that Herversian canal runs that neurovascular unit. Okay? Osteocytes are the mature bone cells in bone. I'll talk later about the bones that help deposit or break bone tissue down. Okay, we'll get into that in the future. I have that, I'm pretty sure, at the end of this lecture. Okay. All right, but osteocytes are the mature bone cells. You with me? And everybody's glazing over as I talk about the microscopic stuff. Canaliculi is a really funny word. And what that means is, what's this centered portion here? What is that called? Herversian canal. What's in here again?
Is it nerves?
Nerves, arteries, veins. Can we just keep them in here and support the tissue? No, they need canals to get nerves, arteries, and veins out to the rest of the tissue. Those are called canaliculi. And they look like little canals, that's the last, I think, definition there, or word there to be defined, that come out from that center portion, right? and it provides that nourishment to the rest of the tissue and carries with the waste. Are you with me? Caneliculi. Now, we also have in those lamellae the osteocytes. You'll see them right in there. Okay? Does that make sense? Any questions on that? Okay. This brings you to a larger chunk of bone tissue. And this is what, I need a clicker for these overhead lights here. This is more what it'll look like on this. Oh, here, perfect. This is exactly how it'll look like on your slides when we look at them. But I like this picture because it shows how you have multiple of those osteons lumped together. And then surrounding it, you actually have what are called circumferential lamellae, which provide more of like a uniform outer barrier on the compact bone itself. And then you see the vascularity kind of snaking through. Okay? Yeah.
What's the difference between osteocytes and lacunae?
Lacunae are the space that osteocytes sit in. I didn't realize it was up there. Yep, so it's the space that they sit in. Good. Any other questions? Good? Awesome. All right. Pardon me. Not much to really say. Spongy bone has a haphazard appearance. There's no set osteons like we saw in compact bone. Has similar structures. I would never show you a picture and ask what they are. Just know those general concepts. Okay. So, I've mentioned this sort of several times, but here's the actual definition of the soft and the hard portion of bone. So the organic and the soft portion are cells in osteoid. That's like that cartilaginous, well, it is cartilaginous precursor to bone itself. And then we put the minerals in to harden it. So this is where we start to have some problems, right? If we have children that don't have enough calcium or vitamin D or magnesium or phosphorus, they get the osteoid, but what don't they get? Okay. You get the soft osteoid that begins the formation of the skeleton, but it doesn't what? Harden. We'll see the outcome of that as we get further along, okay? So if those bones don't harden, you don't get those mineral salts, the bones will be brittle and soft. More brittle in adults, but softer in children. That's kind of how it shows up, okay? Yeah, because we tend to, not quite sure why, children will get deformations.
Is that like rickets?
Then, yeah, it is.
Okay.
And then adults tend to get fractures. They'll get deformations as well, but they'll get fractures. So I think for some reason adults it makes them a little more brittle, but in children it does. And I have that a little further along. So, okay. We want to have that good balance. Okay. Ossification or osteogenesis is the formation of bone. This blows my mind. By week 8, your little baby is starting to form its hard skeleton. Okay. Now, keep in mind, the whole thing doesn't start to harden at one time. We have what are called growth centers that will begin to harden and move out. Okay. So it's not like it just immediately starts to harden. Okay, so we have hyaline cartilage and fibrous membranes. So the majority of the bony skeleton comes from hyaline cartilage. That is called endochondral ossification, right? I always remember cartilage sounds like chondro. Chondro means cartilage. Endochondral is going to be cartilage ossification, okay? That's the majority of the bone. Now we also have intramembranous ossification. The major difference, or the only difference, is the tissue that's being hardened. Are you with me? With endochondral, it's going to be hyaline cartilage. With the intramembranous, am I going too fast? Because these words are like huge. Is this making sense? Okay. With the intramembranous, this is a fibrous membrane. It's a different type of tissue. That's all it is. And the only areas that we learn about that is cranium and clavicle, and luckily they start with the same letter, so that should help you to remember. Okay? So intramembranous will be found in the cranium and the clavicle. The precursor is that fibrous tissue. The rest of the skeleton will be hyaline cartilage and undergo endochondral ossification. Ooh, sounds so smart when I say that, don't I? It's just a facade. I'm just pretending. All right, does that make sense? So they have these little bitty growth centers that start to harden and move out and make the bones harder and more solid. Do they come out with their entire skeleton ossified and hardened? No, no. We'll take a peek at that in just a second. But 8 weeks, that blows my mind. It's crazy. If you or your significant other ever gets pregnant, there's several places you can go to see embryological development. I did mine through Baby Center, where they said, I think it was every week, they sent the development of the baby, and it was really cool to watch, especially after you've had A&P. I would check it out. Okay, so let's look at these steps with endochondral ossification. I think that you don't need to know every step of this by any means, okay? I think what I want you to understand is that there's going to be primary and secondary ossification centers in long bones. The primary will start in the middle, ossify, and then eventually hollow out, so we can put that yellow marrow into it. And then the ends start to ossify. Those are the secondary ossification centers. Are you with me? And those will expand out. With the secondary and the primary, as they start to meet, what do they form? With the primary and the secondary, as they start to form, it's right there, they form that growth plate. That growth plate stays cartilage in a female until they're 18, give or take, and a male until they're 21. Okay, well, that's further in the notes, give or take, okay? We also leave a little bit of hyaline cartilage on the ends of long bones, right, to work as that articular cartilage and protect the ends of long bones, okay? Are you with me? So it's kind of like the sew process of calcification, then it'll hollow out the center, and then blood vessels will leave in, and then you'll have the periosteum created on the outside. All right. I think the takeaway that I want you to know is primary versus secondary, that the growth plate is left, that the articular cartilage is left. I think that's the takeaway from this. Okay? Cool. Any questions? All right. We're doing on time. Gee, I've gone through all of that. The top 2 bullets. Long bones will lengthen at the epiphyseal growth plate. Females will close about 18, males will close 21. They always I remembered this because I went to high school with a kid. Oh God, well, he's not a kid now by any means, but he went away to school probably this short compared to me, and he came back from college like this much bigger because he had his growth spurt when he was like 20. You know, so males can grow all the way to 21. Is that common? Not really. Usually we'll have our growth spurt as a teenager and stop growing, but he just, I don't know, kept growing, okay? Females generally close about 18. You've usually reached your full height about 18 years of age. Those growth plates then calcify and your bones will stop growing lengthwise, but you can have them grow width clockwise. That is called oppositional growth. Now, are they going to go from this to this? No, but they're going to get a little thicker as we get older, okay? Now, I'm going to have to draw this one. Well, I'll have to leave the light on. Hopefully we can see this. I'll try to make it nice and big for the video. And I think this makes sense, but I think it's a little helpful if I draw it. Okay. So we have osteoblasts and osteoclasts, which are right on this slide. Okay. Osteoblasts deposit bone. Osteoclasts break bone down. And I think it's right in the notes, isn't it? Right. Okay. So osteoblasts deposit bone. Osteoclasts break bone down. And your bones are constantly doing this. So they can regenerate themselves, I mean, very slowly, you understand, right? They're releasing calcium, they're depositing more calcium, they're restructuring the bones, they're fixing broken bones, etc., etc. Are you with me? So if I were to take an osteoblast, I'm just going to put that, okay, and put him here, we're going to do what? We're going to deposit more bone. Are you with me? Inside this marrow cavity, if I put a whole bunch of osteoclasts on the inner portion of this compact bone, the inner portion will be broken down. So can you envision or understand that as it breaks down here and it builds up here, it'll get wider, but the thickness of this long bone itself stays, I mean this segment, this half, this edge, will stay about the same width? Do you understand what I'm saying? So it's almost like you're taking this and moving it out. Are you with me? So it's getting wider, but the bones don't get heavier. Are you with me? Does that make sense? No? Yes, no? Okay. Do you know what I mean? So it's like you're taking this width of compact bone from both sides, because don't forget we're talking about a long bone, we're talking about a three-dimensional object and a two-dimensional picture. If this is the thickness of the outside of the long bone, and you're depositing here and you're eating away here, you're going to move it out a little bit. So you're making the size of that long bone wider, but you're not changing how much it weighs. Yes, now? Does that make more sense? No? Robert? Does that make sense? Okay. If it doesn't make sense and you're not answering me, come see me. I'll be happy to talk to you about oppositional growth. Okay? Okay? All right. So people don't feel comfortable asking questions, just write them down if you want to come see me, and I'm more than happy to answer them. Okay? All right. So, osteoclasts are a little slower than the osteoblasts, so it might get a little bit thicker, but I mean not a lot. For the most part, your bones are going to stay the same weight. Okay? All right. Hormonal regulation. So growth hormone in children is a big perpetuator of the increase in the size of our muscles and our bones. That peaks at a certain age and then stops. Well, it doesn't stop completely, but slows. Okay? Testosterone helps males' bones and muscles grow big and strong, slightly bigger than females, okay? Estrogen in females is a big contributor to bone density. That is why when we go through menopause, our bones become more what as females? No, we don't know this? They become more brittle. They'll become more brittle, more apt to break. That's why we see so many females, elderly females, break their hips because that drop of estrogen, is everybody following me with that? That drop of estrogen decreases our ability to keep our bones strong and healthy, so they aren't as strong and healthy, and females tend to be more prone to breaking bones as they get older. Okay? That's why it's important as females get older to do weight-bearing exercises. It's just super important for everybody, really. Okay, does that make sense? Males' testosterone doesn't dip as much as it does as males get older. It dips and it declines, but not like females going through menopause. So they tend to maintain their bone health a little bit better than us. Okay. All right. There's other hormones that can indirectly affect the bones, but that's a good start, I think. Excuse me. So bone remodeling or restructuring, which we talked about the basics of this, either regenerating the bone or releasing or depositing calcium, occur at the periosteum and the endosteum. I'm not sure I went over endosteum on long bones with you guys. Let me go back. Hold on. The endosteum is going to be this inner surface here, okay? The periosteum is the outer, okay, portion. That's where the bone remodeling will happen. Either to regenerate or restructure bone or to release calcium that we need for muscular function. Okay. 99% of calcium is stored in bone, but that 1% that's outside is very, very important, as we spoke about. Okay. Now, this was, I made these lectures, gosh, who knows how long ago, 14 years ago. Pretty much doesn't change a whole bunch over time. But talking about specific hormones that are dealing with the deposition or the release of calcium, they used to say that calcitonin, which comes from the thyroid, we're going to look at that when we do endocrine. We're going to look at where it comes from specifically on microscopic studies. We're going to look at the thyroid, the different parts, and etc. Okay? But there's a hormone that is released from the thyroid called calcitonin. They said they've done research and now shows that this does not put calcium into the bone. Does anybody follow research? Do you ever look up research? You can have one thing say one thing, and then what? Another say another. Okay, so I won't test you on this, but realize that it used to be that calcitonin was a hormone that put calcium into the bones. Okay? Parathyroid hormone comes from the parathyroid glands. I will tell you exactly where they are when we go through endocrine in a few weeks. Okay? That helps to release calcium from the bones. Are you with me? Okay. So, are you with me? Does that make sense? Yes? Okay. So these are hormones that help specifically with the regulation of calcium in the bloodstream. Are you with me? Everybody's starting to get a little fuzzy, huh? Ooh, a lot of stuff on the first day. What does a negative feedback loop mean? Do we just continue to release parathyroid hormone no matter what? No. Our body senses the level of calcium in the blood. When the levels get too low, parathyroid hormone is released until the levels are what? Put back to normal. And then it stops. That's what a negative feedback loop is. Okay? It'll turn it off. Are you with me? Yeah? Okay. All right. Remember I talked to you about when we put stressors on bone, we'll deposit more stress there. It's called Wolff's Law. Okay, this is the actual law that it is called. Okay. Its whole purpose is to keep bones strong at areas of stress. So if we look at this is a good picture because it shows like compression onto this bone will actually create, what's the charge, let me backtrack to this. What's the charge of calcium if you were to write it? Ca plus, right, plus 2 I believe, but let's just say plus. So it's a positively charged ion, right? Where we have areas of stress in bone, it becomes negatively charged. So it will draw calcium into it, okay? Or it attracts those calcium ions. So with Wolff's law, we create a negative charge on the bone in areas of stress. We deposit more calcium into it. This is why we tell elderly people who are getting thin bones to do what? Weight-bearing exercise. It'll put stress on their bones, create a negative charge, and draw more calcium to those areas. Okay? Sometimes this goes awry, and we develop what's called a bone spur. If you've been an athlete, you've had an injury, you've run into a door, I don't know, you've done something, right? You've created an injury somewhere that took a while to heal. Some of the side effects of that may be creating a bone spur, a little extra lip of bone that your body has put there to try to protect itself, but kind of did it in the wrong way, okay? In the normal body, it helps to keep bones just nice and strong and healthy. Okay. All right. Let's do one more quick 2-minute break. We probably only have what? Oh, we still have a chunk of slides. Yeah. One more quick break, and then we'll go over fractures, which is kind of fun. All right? And diseases. So bone repair. I think I'm gonna, can you guys write okay if I turn the lights off? Yeah. Okay, because these will be easier to see. We're gonna look at some x-rays. So there's, all different types of fractures. Let's go through these really quickly. So non-displaced versus, I started that back up, right? Is it recording? Mm-hmm. Okay, great, thank you. Non-displaced, that would be just my way. Non-displaced versus displaced is pretty obvious, right? That's gonna be, if you're talking about a long bone or any type of bone, if the ends are what? Moved. Why is that important to understand, other than knowing it for the test? Yeah, that's a fun thing, isn't it? Okay? If the ends are displaced, they need to... Sweet goodness gracious. Don't hold back, please, by any means. We know each other well. We tease each other. Okay. You okay? Yeah. Is your brain in place? No. Okay. So I know. You poor guys. Do you want some wipes? Hand sanitizers. Okay. All right. All right. What are we talking about? No, I'm just kidding. Okay. So non-displaced versus displaced. It's important to get it surgically or manually replaced before it's casted. Okay. I can't give out names, but I know somebody who had a displaced clavicle fracture. And that's a bad one. Let me tell you why. Because it stays, first of all, it can affect the blood vessels there, because you have your subclavian artery and vein, which are right there. But what clavicles like to do, if they're not surgically fixed, is to form a fake joint. And so guess what he always has now? Movement at his clavicle. So you gotta really make sure, and that's a tricky one, because if you push it too far down, you go into the blood vessels. But anyway, you gotta have the ends approximated, okay? Complete versus incomplete, I think we got that, right? Whether it's through or not. Linear versus transverse, whether it goes the length of the bone or the width of the bone. I'm gonna go through these quickly because I think they make sense. If anything doesn't jive for you, just let me know. Open versus closed, that's a fun one, open. Open means open, yeah, through the skin, okay. Healing is usually 6 to 8 weeks. My son fractured a little wrist bone and they let him out of the hard cast by 3 weeks, and he had to wear, a removable one for another couple weeks. That was right before we went to Disney, so they were kind enough to take the hard cast off. So,
The linear one's supposed to be linear versus transverse?
yes. Yeah, it's not linear transverse, linear or transverse. Okay, I mean, I guess you could have both, but, all right. Hematoma formation is going to be the first thing that'll happen. We'll send a blood clot there, and guess what that blood clot does? Multiple things. Clears all the junk out if there's any infectious agents. And then it will send structures which will help to clean out the old debris. It'll send new fibers in there to create that soft bone first, which is the fibrocartilaginous callus. And then after that gets established and we clear all the junk out, we'll start to deposit new mineral salts. Okay, your bony callus and then your bony remodeling. And the great thing about it is if the ends are approximated and pretty put together, the new bone looks pretty much like the old bone, if not a little bit better, with a little more bone deposition there. Okay, so we're pretty good at fixing bones. Pretty good at that. So, some common types of fractures. Here's the one that my little old lady had. If you have a patient, especially an elderly female, who's pushed up, that's how she fractured her vertebra. She was pushing up on a garage window. You know how stuck those get? Sometimes you gotta push it, and she was pushing up and she hurt the pop. So that compressive nature tends to lend itself to these compression fractures. Comminuted is multiple fragments. What's this poor guy gonna undergo? Yeah, probably multiple surgeries would be my guess with this. Okay, I have a little bionic leg. Okay, spiral. Are we all in healthcare? Are we all going into healthcare for the most part? Some research maybe. Okay, spiral you should learn as a healthcare practitioner, if seen in the arms of children, may be indicative of what? Child abuse. Usually we'll see spiral in these cases because what is the adult doing to the child? Twisting, okay? You will be, I think, a mandated reporter, right? Yeah, so you will have to, by law, report that if you see that in a child. Have I grabbed my kids by the arm? I have my little 7-year-old redhead. Did you used to run out into the road? Because he runs out into the road. And I had a GC, and I have grabbed him several times. Of course, I had to talk with my pediatrician at one point. I'm like, you understand, like, I do not abuse my children, right? Like, broken noses, chipped teeth, broken feet, broken wrist, broken this, black eyes. I'm like, no, But I've grabbed his arm when he's run out. I mean, does it indicate abuse? No. But I'm just saying, it's sort of like a flag if you see that repeatedly in a child, okay? That spiral fracture, okay? And it spirals down the length of that bone. Epiphyseal fracture. Why would this be bad in children?
That body part's not gonna grow anymore.
Yeah, you really need to have a very good surgeon fix this if you have a fracture through that growth plate, or that bone will stop growing. That would not be good. Not as dangerous in an adult, right? I don't think I'm growing anymore. I don't want to grow anymore. I'm good. Depressed fracture. If some sort of force depresses into a bone, that makes sense. It would have to be an external force, obviously. I would think, car accident, something like that, ball peen hammer, Right? Isn't that what that looks like there? Okay, I'm gonna go off topic, but I think this is a great story. Did I ever tell you guys about the knife story? A guy I dated in college had a cousin who was a nurse who had a patient come in with just awful migraine headaches. He was in his 70s, 80s, something like that. And, excuse me, asked him all these questions. The headaches were new, they had just started, whatever. They ended up sending him, thank God, for a CAT scan. He had a knife stuck in his head. He had been in the Navy when he was young and got into a bar fight. So the lady's like, you have a knife, and it was healed. It was like, yeah. Isn't that crazy? Stuck. And it must have just gone right between the two lobes of his brain where it didn't affect anything. He's like, I don't think, oh yeah, I was in a bar fight when I was like 20.
And you didn't feel yourself getting stabbed?
No.
Don't join the Navy.
Yeah, you were a little drunk.
He's probably a little drunk, would be my guess. Oh, just wait for all the things you see as a healthcare practitioner. Okay. All right. Yeah, that's always a good one. It has nothing to do with what we're talking about, but I think it's a cool story. Green stick. You ever been playing out in the yard and you got a stick that's green? You try to break it to make, a sword or whatever, and it doesn't break. Okay? We see this in softer bones, right? Especially in children, where their bones are not hardened yet, and they get what's called a green stick fracture, and it creates just a little partial break into the bone, just like you would with a green stick. Okay? I don't think you're going to hear people saying that too much, but it's kind of a neat one to know. Okay? So all different types of fractures. So other things that can happen with the bones. Can you guys see okay? I think with these next couple slides it's easier. Here we go. This is that we mentioned earlier, rickets. So rickets in children, which luckily we don't see in children who have enough foodstuffs in our country, because we have so many what in our country? Fortified foods, right? We have fortified formulas and breads and supplements. I mean, I know that there's children who don't get enough food, which breaks my heart, but we have enough fortified foods in our country with calcium and D and magnesium and phosphorus that our children luckily have strong bones. If you have a child who doesn't get enough calcium and or vitamin D, do you understand why vitamin D is important?
Doesn't it help with calcium, absorb?
Yes, it helps us so vitamin D absorbs calcium from the intestines, okay? There's a specific form of potassium as a sidebar called K2, which deposits that calcium into the bones, okay? So vitamin D absorbs it from where? Intestines. K2 deposits it into the bones. Because guess what they started finding? Because everybody's like, oh, calcium, great, I'm going to start taking supplements. And people would take supplements. Well, guess where the calcium was going? It wasn't going into the bone. Well, it was going into the bones, but it was also going into the blood vessels and creating hardened blood vessels. So you need to make sure if you're going to take calcium, to take the proper supplements to help the absorption and the deposition of it. I'm huge into vitamins. My husband picks on me all the time, all my jars and lotions and potions. I will not take calcium from a bottle. I will not. I get milk, I get yogurt, I get cheese. I just think it's the best way to go. I really do. And take a walk in the sun for 15 minutes a day, okay? It's one of the few things I won't supplement with. Another sidebar. Okay? Yeah, just coming from a bottle, it scares me. Anyway, okay, so back to this poor baby didn't have enough calcium and vitamin D, and what happens in infants is they get that bow leg. Do you understand what bow leg is? Okay, where they get that curving of the legs. And yes, unfortunately, this would be a permanent affect for this child, okay? That is called rickets, okay? We can also get this in elderly. Elderly people don't do weight bearing, don't take their calcium, don't get sun, they can get softened bones as well. And that's osteomalacia. which is a little different from osteoporosis, which is on the next slide. Okay, so I'll explain that in just a second. So osteomalacia is when we have that soft osteoid precursor, right? But we don't get the calcium salts into it. So you get that structure, but you don't hurt in it, and the bones can become soft. You can get some bowing with it. It won't be quite as much as that bullying with the children. What we tend to see is also some fractures in these patients with osteomalacia, okay? So softened bones in adults, osteomalacia, in children it's rickets, okay? Simple cure, drink some milk, right? Now, the difference with osteoporosis is the matrix, or the structure of the bone is okay, the composition I should say, but there's what? It's a lot more porous, or there's a lot less of it with osteoporosis. So inherently you're not going to have as much to create that strength, right, with osteoporosis. I'm surprised. So we see this more often in elderly females. That's what I was looking for on the screen. Okay, elderly females. Remember I talked about the whole estrogen thing. This is what it contributes to. Could also be due to lack of weight-bearing exercises, vitamin D, calcium, etc. Kind of work in the same song, aren't they? Okay? Does that make sense? So that's different from osteomalacia because that's that softening. This is, there's less of the bone matrix and stuff. Okay? Let's see. Okay, and the actual, so not only do we have less of it, the bone itself, there's just not enough on these little indentations itself to create a strong bone matrix. Oh. Okay, so, you see, we talked about most of this. The thing to keep in mind, I joke about this, but I'm serious, I don't do drugs, right? In many aspects, I don't do drugs. But I don't teach drugs. I don't teach pharmacology, is what I'm saying. What I do want to say as a holistic practitioner is to always look at benefits versus cost or risk, right? So you can take estrogen to help the strength of your bones, but estrogen is linked with possibly higher levels of cancers too, if you're prone to it. So I do have this in the notes. Can't really talk to you about drugs. I just want you to always research and think about benefits versus risks for every medication that you take. Okay, Fosamax, which is one of the drugs that they give for bone density, I think at absolute best is a 7% increase in bone density. If you do exercise and take calcium and, well, maybe the exercise and the calcium and whatnot is what's making your bones thicker. You see what I'm saying? I'll probably get chastised for saying this, but always look at benefits versus costs when you're looking at these medicines. I'm not a big fan of these bone density medications. I'm just not. Okay. And that new one that's out where you get a shot like once a year, I don't know. I don't know about that. Okay. But anyway, so I have that up there. I wouldn't test you on it, but just for your own edification. Okay. So when we talk about, just as a refresher, conception, egg sperm, we form a ball of cells. Those ball of cells develop. There's several steps in between. We're going to go into the future. We form 3 layers: endoderm, mesoderm, ectoderm. We're going to go over all this towards the end of this semester. Mesoderm is up here. Okay? Mesoderm will be where we get bones and muscles from. Other structures as well. Okay, other structures as well. We know that we start to ossify by week 8. Everything is mostly ossified except for the epiphyses, those growth plates at birth. We also have what are called fontanelles. We'll go over that in lab. Fontanelles are the soft spots in the child's head. So when they come through the birth canal, the head can kind of compress a little bit. and get through the birth canal easier. Okay, we'll go over that in lab, don't worry about it. Okay. And then the rest of it, I think, makes sort of sense. Okay. Does that make sense? Any questions on that? Is that the last? Isn't that cool? Do you see all those ossification centers? And I like that picture because it shows how they'll all grow towards each other and form that nice solid bony skeleton. Okay. Bone mass decreases with age beginning in the 4th decade. 46, losing bones. Okay. Rate of loss is determined by genetics and environmental factors. In old age, more bone resorption predominates. You lose more bone mass. That's all common sense stuff, right? All right. So, any questions about bone tissues? You're good?
Yeah.
Excellent.